You have just returned to the ward after teaching, when the sister approaches you and asks you whether you took a particular patient's blood that morning. She says that one of the nurses has just found a tourniquet still on the patient's arm and that his hand and wrist have turned blue. You remember that it was indeed you who had bled this patient. Choose the 3 most appropriate actions to take in this situation. A. Apologise to the patient and let him know that you are taking steps to ensure that it doesn't happen again. B. Ask your FI1 colleague on the ward for advice about what you should do. C. Check the arms of the other patients on the ward that you bled to make sure you didn't leave a tourniquet on anyone else's arm. D. Deny that it was you that took the blood and quickly return to your jobs. E. Don't let the nurse know that it was you who had taken the blood, but go and apologise to the patient when you have a spare minute. F. File an incident report stating exactly what happened and who was involved. G. Own up to the fact that it was you that had bled the patient. H. Ring up your educational supervisor and let him know what has happened. Answer AFG. This question assesses your response when things go wrong at work. It is important first and foremost to own up to any mistake, G, to take steps to minimize further risk to the patient, and then to report it through the correct local channels. This often takes the form of an incident report, F, which should be completed as soon as possible after the event takes place. In addition to the formalities, you must always maintain open and trustworthy relationships with your patients and, therefore, apologizing to and reassuring the patient is another important task that should be completed imminently. A. Option C would not be incorrect. However, in this situation, a colleague has alerted you to the mistake, and it is arguably unlikely that you would need to check other patients. While FI1 colleagues can be useful sources of some information, B. In this instance, there should be no need to consult colleagues, as you should always own up to your mistakes. Denying blame, D, is dishonest and contravenes many of the duties of a doctor. In particular, be honest, open, and act with integrity. This behavior could lead to further disciplinary action. Option E is similarly dishonest, and despite apologizing to the patient, it does not deal with the mistake in a professional manner. Discussing the incident with your educational supervisor, H, is certainly a good idea in the slightly longer term. However, it is not one of the first things you should do. You are the FI1 on a busy respiratory ward. Yesterday, on the ward round, your consultant asked you to order a computed tomography, CT, scan of the thorax for one of your patients who has been complaining of hemoptysis and weight loss. He also has an abnormal chest X-ray. While chasing the results, you realize that you have requested a CT scan of the abdomen by mistake, which has unfortunately been carried out. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Ask your consultant to return to the ward so that you can explain your mistake. B. Fill in another CT request form and don't tell anyone about your mistake. C. Inform the patient and apologize for your mistake. D. Request another CT, ensuring that you fill out the card correctly this time. E. Ring your consultant to explain your mistake. Answer EDCAB. This question assesses how you deal with making mistakes in clinical practice, in particular with regards to communication with the patient, your colleagues, and the steps you take to minimize harm. In this scenario, a CT scan may be very helpful in providing more information about the clinical condition of the patient. However, this should be balanced with the additional risk of radiation exposure from another CT scan. Option E is the most appropriate response initially, as it is important to be honest with your colleagues about mistakes, and your consultant may wish to come and speak to the patient. You also need to check whether they would like another CT scan to be requested. This is possible on the phone, therefore, it is a more suitable response than option A. Option D is the second most appropriate, as it demonstrates a proactive attitude and means that, when explaining the situation to the patient, you can reassure them that you are taking steps to rectify it. Option C is important, as you must be open and honest with patients. However, there are other steps to take first. The least appropriate response would be to keep quiet about your mistake. B. This is unprofessional and does not show honesty or respect for the patient.